Hi, I'm Rebecca Luna, and this is my oral presentation of my nutrition and oral health research project. A little background information. I have worked and am working in the dental field and have for the last 13 years. While I am not a dentist or hygienist or a professional, I do work in the business office. I interact with patients and am more knowledgeable than the average citizen on the dental field. A question we often hear from patients is, if I'm brushing and flossing and doing what I'm supposed to do, why am I still getting cavities? Which is an interesting question because we've all been taught that brushing and flossing and practicing good oral hygiene is what's going to keep you from getting cavities. I don't believe that that is the total picture and wanted to investigate more information. Often, our patient education involves hygiene techniques and behaviors and doesn't really address what foods or other things that can be added or taken away from a person's routines to increase and maintain good oral hygiene. Sometimes you'll hear hygienists and doctors say, we need to stay away from the sugar, or mom, let's drink more water instead of juice. But you don't ever hear a lot of information on other things other than brushing, flossing, and having those good hygiene techniques to prevent cavities. We know that sugar causes cavities. Um, the sugar on your teeth sits, it forms plaque, and that is how you and eventually causes decay and other dental diseases and conditions. Acidic foods are also bad for your tooth enamel, which is the protective outer layer of the tooth. So you will hear maybe the doctor saying sucking on lemons can be really bad for your teeth, but also anything that increases that pH and causes a more acidic environment can cause what they call erosion that eats away at that tooth enamel, and which can lead to decay and other dental conditions. There's a thing called baby bottle syndrome, where babies are drinking out of the bottles, they're drinking the juice out of sippy cups, and it can eat away and decay teeth to where there is nothing of those baby teeth. And it can be mild cavities to very extreme cases where a baby's teeth is rotted out completely, and that does have an effect on the permanent teeth that come in afterwards. And this all begs to the question, besides brushing and flossing our teeth, what can we do to maintain good oral health? My working thesis is that dental professionals should focus on diet and nutritional education in tandem with proper hygiene techniques to improve and maintain good oral health of the patient. A few of the questions that I've been asking with this working thesis and as I've gone into my research are, what impact does diet and nutrition have on the oral health? What food cause cavities? What is the relationship between nutrition and oral and the overall health? Is nutrition good for oral health? Because just like with your overall full body health, eating the proper foods and getting the proper vitamins and substances in your body promote a healthy environment? Or are there certain foods and substances that we need in our diets to promote oral health specifically? Is oral hygiene the most important factor in dental health? If we're eating a lot of sugary foods, if we are eating constantly, snacking, and not allowing the pH in our mouth to go back to a neutral and less acidic environment. But we are brushing twice daily or more, flossing, and using those good oral hygiene techniques. Is that enough? Or is the diet and nutrition just as important, and eating behaviors to promote good dental health? Or do all foods cause cavities? Or are there some that do not? And vice versa, are there any foods that reverse tooth decay? In fact, in my research, it looks like there might be some that can reverse demineralization of the tooth enamel, which can help prevent cavities, as well as actually preventing cavities by consuming a bacterial strain that causes cavities. So, what are the best foods and or best diet for oral health? And are dental professionals properly trained on nutrition and its effect on oral health and on educating patients? Just because the doctors have the knowledge doesn't mean that they know how to properly convey that or are properly conveying that to their patients and giving the patients all the tools to maintain their oral health. The four sources that I have are my main sources for my research. The first is an article titled "The Effect of Xylitol on Dental Caries and Oral Flora." This paper explores the effects of xylitol, which has been found to prevent cavities from forming, and be what they would call cariostatic. So it's not forming caries, which is cavities, on the teeth, and can even help with remineralization of the tooth enamel, which helps keep the teeth strong and healthy and also helps prevent future decay. I believe that this is a good source because it goes into the studies and really the process of how cavities and dental decay forms, as well as highlighting what forms of xylitol help, the amounts, and how it actually helps in the prevention of cavities. My next source is from the American Dental Association, which is the official organization of dental professionals in America. This is the information that is for and which dental professionals, dentists, hygienists, and others actually use this information to base what they tell their patients in their clinics and in their practices, as well as how they perform and practice in their offices. The article that I use called Nutrition and Oral Health actually states that it does combine and take different trials, clinical trials, epidemiological trials, case studies, and it does say that different studies are more reliable than others and have different interpretations, and goes into how nutrition and oral health go hand in hand. My next article is actually a study entitled Good Oral Health and Diet, and it was conducted specifically to describe the relationship between healthy eating habits and oral health status. Because it provides such detailed information on different topics, including how the oral cavity and tooth enamel are formed and how diet affects that, how dental diseases and other conditions that plague, such as dental caries or cavities, enamel erosion, periodontal disease, all of these, and how the diet affects this and can actually help prevent it, or if lack of nutrients and lack of substances can be detrimental. And my last resource is Impact on Diet on the Oral Health. It is actually an article written by a registered dental assistant for a dental hygienist publication, and it can be used as a continuing education course in which to provide that information that dental hygienists can use in their practice. It goes into depth on explaining how oral health is affected by nutrition, and it also describes certain popular diet trends such as the keto diet, intermittent fasting, the paleo diet, how they can be beneficial and detrimental to the oral health. And that concludes my presentation. Thank you for listening.